Use of the CDC Guideline for prescribing opioids for chronic pain by providers and health systems can improve patient safety. Working with providers, CDC developed quality improvement measures to support implementation of the recommendations in the CDC Guideline. Health systems can use the CDC quality improvement measures to track their progress. There are 16 voluntary clinical measures in two categories: new opioid prescriptions and long-term opioid therapy. These measures can be applied to any practice or system, large or small, and incorporated into new or existing quality improvement or QI processes. We asked leaders in the healthcare field about their experiences implementing quality improvement measures. Here's what they had to say. What improvements have you seen as a result of implementing the QI measures?
Prior to establishing these measures and prior to tracking these measures, we found that usage of our prescription drug monitoring program was at less than 50%. After making some of our changes, we now have greater than 90% across all specialties, which has been a significant improvement. Not only that, but we feel that across the organization, there's more ownership of this particular issue. We know that this can be a very challenging and complicated patient population. And at the end of the day, all of us really want to be able to help this population in any way that we can.
The major positive change, it's certainly gratifying to see as an organization that we're adhering to process measures better and seeing the improvement overall going up. I think one of the unexpected things, which I mentioned before, was just seeing the number of patients on chronic opioids actually decrease as we were adhering to guidelines better. So that was a really good thing. And also just engaging other staff besides clinicians and doctors, engaging refill technicians, other clinical pharmacists. I think that was very helpful.
I think it's become easier for us to talk about how we reduce harm with chronic opioid therapy. And that was one of our major goals here, or an unintended, I guess, consequence in a positive way that we saw. So now as a community, we can better talk about how we take care of patients receiving opioid therapy. And I think it helps reduce the stigma around this subject as well. And so a few things that we're trying to normalize within our clinical care are doing routine drug testing, making sure we have prescriptions of naloxone for patients who may be at risk for opioid overdose, and also routinely, annually going through a risk-benefit analysis using a consistent tool like a controlled substance agreement to talk about how we're taking care of patients.
I think one of the things that we're seeing is we're definitely seeing more ownership. And so I think people are thinking about this in a different way. Whereas before we really knew what some of the risks of unlimited opioid prescribing were, people are looking for different strategies and how can we effectively take care of this patient population. And with that, there's been more collaboration. So looking into how do we get creative, would additional physical therapy be beneficial, and having those lines of communication open. How do we engage our behavioral health team into this? And so I think the biggest thing we're seeing is just more collaboration across multiple disciplines.
The QI and care coordination framework help providers and health systems develop processes that support safer, more effective opioid prescribing. For more information, review quality improvement and care coordination, implementing the CDC Guideline for prescribing opioids for chronic pain. Also, refer to Module 8 of CDC's interactive online training series, Applying CDC's Guideline for Prescribing Opioids.